Is your vet making your guinea pig sicker? And is the cure worse than the disease? Hey, it's Scotty. I'm a volunteer at the Los Angeles Guinea Pig Rescue, and I've been getting a number of messages recently with the same theme, and that is that the guinea pig goes to the vet for something, and then before you know it, they have lost all appetite and they're not eating. Maybe they're not pooping. Maybe they go into GI stasis. So before we get into this, I just want to say that, I got to be really careful here when we talk about vets and when we talk about illness and the treatment of illness, because, there are many situations where guinea pigs are not doing well, and despite the best possible care, a very knowledgeable and experienced vet, the outcome is not good. And that is in no way the fault of the vets or anybody, because the guinea pig is either older and sick, or there are circumstances that we just can't understand or know or predict. Oftentimes illnesses or symptoms can overlap or appear to be one thing when it's really something else. When guinea pigs are in organ failure or their body is shutting down, oftentimes they will get bloated or they will lose appetite. And as their system is shutting down, it may look like GI stasis, but in reality there's organ failure or there's something else going on. Maybe there's a tumor that we can't see. So I just want to be really careful to say that, if you take your guinea pig to the vet, or any pet, any animal for that matter, and they get worse, that's not necessarily related to what is happening, the diagnosis, the plan, the medication, etc. But that being said, I do want to talk about medication, specifically antibiotics, and just kind of go through this, because I've been getting a number of messages. It's been like a theme this past week where I get a message, someone says something like, oh, my guinea pig, they went in for a tooth trim and the vet gave them antibiotics, and now they're not eating, and they stopped pooping, and they've lost not only their appetite but all their energy, and they seem way worse than when they went in. So I want to talk about that stuff, and then kind of go over a little bit of, take a step back and talk about what you should expect, what you should ask for, how you should communicate with your vet, so that when you take your sick piggy into the vet, they don't end up worse than when they started. But like I said, we've got to be very careful, because there are so many factors, many of which we can't know, and a negative outcome doesn't necessarily mean that something bad happened or what we're talking about here. Let's talk about your typical vet visit. Your guinea pig is not feeling well, they are showing symptoms or signs of illness, and you bring them to the vet. Now, you are going to have noticed something which caused you to be concerned, and that is what you have to communicate with your vet. And your vet, based on what they see and what you tell them, they're going to try to come up with a diagnosis of an illness and then a plan for recovery. Now, so many times your guinea pig is sneezing, or they're making some weird noise, or they're acting a certain way. You get an appointment, maybe it's 1, 2, 3 days away. You take them in and they're not making that noise, they're not acting that way, and you have to communicate what it was. Now, if you can get video or audio of, a strange noise or a sound or a symptom, that is going to really help the vet, because a lot of times when it comes to a respiratory infection, things like that, they're going to prescribe medicine and hope that it works. And unless you're doing a specific culture and you're sending it out to find out what the exact bacteria is, or if you've done an x-ray or other diagnostics to figure out exactly what's wrong, oftentimes the vet will just go based on symptoms. When it comes to respiratory infection and things like that, you see sneezing, runny eyes, runny nose, maybe a little bit of lethargic behavior, loss of appetite. Your vet is going to take those into consideration, and in most cases they'll say, all right, well, let's prescribe an antibiotic and then see how it goes. And if the symptoms go away, if your piggy starts acting and looking like they're feeling better, then problem solved. But where we run into trouble, and this is what seems to be happening frequently in the messages that I've been getting, is that pigs will go in for something. Now, if your pig goes in for surgery or a tooth trim, or maybe they have a tooth root abscess or something else that requires antibiotics, the antibiotics may cause digestive issues. And so maybe you went in for a tooth trim and they give antibiotics just in case, because maybe there was some abscess in the mouth. Now all of a sudden they've stopped eating, they've lost their appetite. Now when it comes to tooth trim specifically, getting the teeth trimmed, getting them ground down, that can be uncomfortable. So often pain medication will be prescribed, and often antibiotics will be prescribed if there is some other underlying infection. Now, at the LA Guinea Pig Rescue, generally we are using, and I've seen my vets moving away from Baytril, which is enrofloxacin, to Bactrim, which is the trimethsulfa. I'll put it right here, the medical name of this drug. There are so many different antibiotics. Some of them can really cause bad stomach upset, and it seems to be that Baytril, the enrofloxacin, actually, some pigs really react bad. Within 12 to 24 hours, they've stopped eating, their body shuts down, they go into GI stasis, and it ends up being way worse than whatever was going on. So this is where I wanted to draw your attention to, and this is where open lines of communication and understanding what the medication is, why your guinea pig is taking it, and what to expect and what the possible side effects are. That's really extremely important, that you as the owner, the guinea pig patient parent, understand what's happening and understand what to be looking for. If you're ever in a situation where you leave the vet and you don't understand what the treatment is, what the diagnosis was, or you see some side effects that you didn't expect, you've got to reach out to your vet and communicate, ask for them to explain it. That's what you're paying for, and it is up to you as the caregiver to fully understand and know what's happening. And like I said before, oftentimes if there are not diagnostics, in many cases the vet will prescribe medicine and we'll see how it goes. And if you notice a side effect, a bad reaction, something like that, your vet is depending on you to identify that, to reach out to them so that the treatment plan can be altered with the new circumstances. So that's incredibly important. People reach out to me and they send me messages, and oftentimes they'll say, is this medication appropriate? Or my guinea pig went to the vet and now this is happening and it seems like they're getting worse. And I welcome these messages and I have to answer them. I've been volunteering at the Los Angeles Guinea Pig Rescue for over 10 years. I have a number of piggies, and I also have been communicating with you for quite a long time. And so together we have really learned a lot, and we're continuing to learn. So I would love to share what I've learned if someone messages me directly. But it is also very important that you reach out to the vet. The vet is going to be that person that should be able to explain everything to you. And if for some reason you got a bad feeling, you don't trust your vet, then you shouldn't be going there. You should find another vet. I do have a worldwide vet list on my website. I've accumulated a number of vets from all around the world because people have reached out and sent me messages about their vets, and I've added them to the list. But if you don't feel comfortable with your vet, then you've got to find another vet. And it doesn't hurt to have two vets that you trust, because you might not be able to get an appointment with that vet as quickly as you would like. So I wanted to take some time to talk about bad reactions to medication and communication with your vet, and changing circumstances as the treatment, as the illness evolves and changes, because you don't want the treatment to be worse than the disease. You don't want the cure to actually cause more problems, and you want to know what to expect. So it's been really upsetting that I've been getting these messages where people go in for one thing and then all of a sudden there's this whole other reaction and side effects and consequences of what seem to be, in some cases, just a rudimentary or common illness. So I hope this helps. I hope that I was able to explain it clearly enough. Let me know in the comments if you've had any experiences like this, or if you have any techniques or advice for how people can best communicate and understand what's going on with their piggies when they do go to the vet, and when they are dealing with sick piggies. I definitely encourage you to read through the free guinea pig care guide on my website, especially the common illness section, because it's important to know what symptoms to look out for so that you can catch them early, because that's the best way for a quicker recovery for your piggies when you know what to look for. And picking up your piggies every day, maybe giving them a little treat first thing in the morning, checking in on them so that you can see if there's any subtle changes in behavior, loss of appetite, or other things, so that you can react quickly. All right, well, I hope this helped. Until next time, thanks for watching.